Good afternoon, and thanks everyone for being here today. Needless to say, it's been a busy couple of weeks here in Missouri, and a lot of things happened. We was at several vaccine sites over the week that we visited personally. Also, we was at many workforce development programs in some of our schools, and just everything seemed to be very positive. Was very proud of some of the work that's going on in the state, and again, the allotments coming in more each week, so that's a plus sign, and we're seeing a lot of people out there. I want to thank all the volunteers, all the people involved in working in these sites out there, and really get and have an opportunity to talk to the people that are taking the vaccine, how important it is to them, and how encouraging it is, and how happy they are to see a vaccine and be able to get a vaccine. So it's glad to see that. I was really glad to go to some of the schools to see some of the programs that are out there on the workforce development. Many schools around the state, the vast majority of the schools have been in classrooms and are still conducting in-class education, and really to go along with the workforce that we've been pushing ever since I become governor, to really see that in full swing when it comes to all the different courses they're doing, whether it's cybersecurity, whether it's IT, whether it's welding, whether it's healthcare, and you go on down the list. But that's become a growing industry out there. It's something that's going to help our state long term when it comes to building the workforce of tomorrow. On the COVID front, we continue to see improvements on all fronts on the COVID-19, vaccines, and the economy. Missouri still is the lowest in the nation for the 7-day PCR case rate and 8th lowest for combined PCR and antigen case rate. Our 7-day positivity rate remains steady at around 4%, and hospitalizations have dropped below 800 for the first time since early August. The healthcare systems continue to feel relief as case rates decline and the vaccine impact kicks in. All of this is great news for Missouri. Each day we are making more and more progress and moving forward. On Monday, Phase 2 of our vaccine plan was activated, making 880,000 more Missourians eligible. Next Friday, on April the 9th, Phase 3 will open to all Missouri adults. We are thankful for our partners across the state for their efforts to prepare for the final phases of our plan and to get vaccines into arms quickly. We had great success with our state-supported vaccine events in the St. Louis area last week, administering more than 20,000 initial doses in just 3 days. This does not even include thousands of doses administered by various other community providers in the area. This week, we also announced an 8-week program to provide an additional 168,000 vaccinations in the city of St. Louis in partnership with FEMA. This program will launch on April the 7th and vaccinate up to 3,000 people a day, 7 days a week, at the Dome at America's Center. We have been communicating with our federal partners about establishing a FEMA vaccination site in Missouri since January. We knew that once supply started to pick up, we would be able to do this, and we look forward to the opportunity to deliver even more vaccines to the St. Louis area. I want to be clear that the conversations we had with FEMA in January and February, they did offer their services to come to Missouri and support, but without vaccine. And at the time, labor wasn't the issue because we had the Guard and plenty of sites. It was strictly we did not have the vaccine to support any more mass vaccinations other than what we could do ourselves. So once the vaccine became available, then we were able to partner with them, and now to do what exactly we wanted to do is to do mass vaccinations. Yesterday, we also announced a mega vaccine event in Springfield in partnership with Missouri State University and the Greene County Health Department. This will be a 2-day clinic at Hammond Student Center next Thursday, April the 8th, and Friday, April the 9th. Our Missouri National Guard, DHSS, and SEMA teams will be on the ground from 8 a.m. to 5 p.m. both days to vaccinate a total of approximately 10,000 eligible Missourians. To date, Missouri providers have administered more than 2.3 million total doses of the COVID-19 vaccine to Missourians across the state. More than 1.5 million Missourians, nearly 25%, have initiated vaccination, and more than 875,000 have been fully vaccinated. According to CDC data, which includes the latest dose administered through federal partnerships, nearly 66% of Missourians 65 and older and 32% of our 18 and older population have received an initial vaccination. Our hospitalization data shows that less and less of Missourians 65 and up are being hospitalized, which means that the vaccines are working for our elderly population. However, I think it is also important to realize that some of them that are going into the hospital as of today are in the bracket of the 50-year-old brackets. So what that tells you, the vaccination, when we took the 65 and the most vulnerable and targeted them, we are not seeing their numbers go up in the hospitalization, but the ones that have not received the vaccine yet are still some of the ones being entered in the hospital. So that's why you're seeing a little bit of a spike on that 50-year-old bracket and up, and maybe Dr. Williams will add to that. But I think that's important, but it also tells you the importance of the vaccine, how it can really curb what's going on. With Phase 3 opening up next week and supply continuing to increase, we encourage all Missourians to consider getting a vaccine to protect yourself, your families, friends, and neighbors. We have come a long way since vaccines just arrived in Missouri, and I cannot thank our Missouri National Guard, DHSS, SEMA, and the countless local state, private, federal partnerships, and our state partnerships for making this a success on a vaccine rollout in this state. It has truly been a team effort, and we will continue working together to provide every Missourian the opportunity for a vaccine. Thank you, and God bless. Dr. Williams.
Thank you, Governor. Thanks, everybody, for being here. One of my fundamental jobs, as I've told you, is to say thank you. And so just spent the past 2 days in Kansas City. I'll be in St. Louis tonight. And just cannot thank the Mexican consulate enough. Invited us in on Tuesday, and the consulate general got vaccinated. And just a wonderful event and some really great stories. I saw some of you report on that. So really appreciate that. And then yesterday was back in Kansas City with Emmett Pearson and the community builders and SWOPE FQHC, Congressman Cleaver, and Tyreek Hill. Big treat for me. And can't thank Tyreek enough for coming out and helping load boxes. It was a great community event. Not only was it drive-through vaccination done by our friends at SWOPE, but also giving out diapers and giving out food and giving out masks to veterans and veterans' families. So just an incredible community event, and just incredibly appreciative to that. We are aware today is opening day, and so the Royals just started playing a little bit ago, and so I've got on my Royals mask, and we're also aware it's opening day for the Cardinals, so we'll put this one on. Not that you're interested, but my favorite team is the one that I'm watching at the very moment, so there you go to that. Also just very much want to thank Robert Nodell. He continues to lead us with what I think is just wisdom as we have to make lots of decisions. It's a very dynamic situation. We're fortunate to have a plan that with our North Star of protecting our most vulnerable, but clearly we have to dynamically, as more vaccine comes in. I want to just take 1 minute and just talk clinically to you about the more we learn about the vaccines, the more encouraged we are. You probably saw this week that it came out that the vaccines are 90% effective. Pfizer is 90% effective after a first shot, 95% after 2 shots. You saw where Pfizer for 12 to 16-year-olds is 100% effective. I just got off the phone with the pediatricians, and they have a little more insight into that than I do, but they think the EUA for Pfizer for children 12 to 16 could come pretty quickly. So we're incredibly thankful for that, and we're thinking about that, looking down the road. When we look at adverse reactions, we look all around the country. millions of vaccines. It's just been very impressive that we're just not seeing the adverse reactions. And I say all that to you because one reason I was in Kansas City on Tuesday and I was in Kansas City on Wednesday, and I'm going to be in St. Louis tonight with Representative Collins, who's very passionate about making sure we get vaccine to the homeless. So I'm going to go put some eyes on her concerns and visit some of those communities. That always helps me to actually see. We have a plan for that, but it helps me clinically just to kind of go visit. So I'll do that tonight. She's very gracious to invite me to her district. But I say all that because I know it seems counterintuitive, but we see a time coming where we'll have more supply than we have demand, and that's all about hesitancy. And so that's why we're so appreciative to the Tyreek Hills and the Swopes and the Mexican consulate that certain communities that we know may have some historical hesitancy are so willing to engage and help us reach those communities. So to Representative Collins and to Swope and to the Mexican consulate, we're just incredibly appreciative. Kelly, I'll be glad to answer any questions.
Any questions for Dr. Williams? Sebastian?
Hey, Dr. Williams.
Hey, Sebastian.
It's been a few months now. I was wondering if the state has an idea of how many employees at long-term care facilities have been vaccinated. Because I know the federal government keeps track through their federal partnership, but I also know that people get vaccines through not the federal partnership. So I was wondering if you have an idea.
Sebastian, we do. I don't have that number at the top of my head. We have that for both staff and for residents, and Lisa will be happy to get that for you this afternoon. Thank you for asking.
Hey, Dr. Williams.
Hey, Emily.
You talked about Representative Collins, and I was going to touch on that. You're reading
Sure.
my mind because she brought that up during a hearing this week, how
She
she
did.
was concerned about homeless, especially north of Natural Bridge. I
Yes.
was going to ask you what you were going to do tonight. Are you talking about vaccinating them tonight? Are you going to see how many people need to get vaccinated? What's kind of the game plan for those homeless in
Yeah.
the St. Louis area, or even Kansas City if there's some there?
What we have tonight mostly is to listen to her. I met with the minority members of the committee last week in Representative Quaid's office. And one thing they impressed upon me is that they know their constituents really well. And so they think it would help us if we could come and visit and talk to them. So I'm hoping to talk to some of our constituents tonight. I'm hoping that we'll go and see some of the areas that she's concerned about. And I offered that also to the other members of the committee. I'm just a big believer, I did it always as a physician, of just kind of getting eyes on a problem. And I know the governor travels all the time. There's just nothing to substitute for actually going. So she's going to drive the agenda tonight. I'm going to call her. I'm leaving right after I finish here, and I've asked her to just to show me those things and tell me those things that she thinks we need to hear. But I'm also going to share with her, we have a very plan, and I'll just go into it very quickly. The plan is really to work with St. Louis City Health Department, St. Louis County Health Department, to work with our targeted National Guard teams to identify those and to kind of put boots on the ground. But again, I think, as a physician, the first thing you do before you institute a treatment is to make a diagnosis, and before you make a diagnosis, you listen. So tonight's really to listen.
Hi, Dr. Williams. We've talked for the past few weeks about the first week of April being when the vaccine supply starts to rapidly increase.
Yep.
So now that we're into April, do we have any specifics on those kind of numbers and how that's going to go out to each region?
Yeah, it's increasing significantly. I mean, we're talking, 250, 300,000. And then you've got to remember federal government has added dialysis centers, FQHCs, 9,000 pharmacies, FEMA in St. Louis with 150,000, Walmart and Health Mart. So all of those, in addition to the state allocation, and with the federal allocation, you could easily conceive vaccinating 1.2 million people here in Missouri in April. And as I was in Kansas City, as I explained to them, every time a vaccine comes in somewhere from whatever portal, including 150,000 in St. Louis, that gives us more ability to have it in other places if need be. If we may leave extra in St. Louis. But the point is that we welcome all the vaccine we can get through whichever portal it comes. But let me just say this. I was just in an interview with the Washington Post. They've made it very clear to us that the state will always be their first priority as they look at their channels. You may have seen an article about Pfizer, the 15 million. We don't think that's going to affect us. We've been told that should not affect our distribution.
Hi, Dr. Williams.
Hey.
You've talked before about how one of the next big challenges is vaccine hesitancy.
Yes.
Do you have any more of an update on like outreach or how you're responding to that?
Yeah, we're getting ready. I have a $5 million plan that's very much geared to that. As I've said before, to me, it all comes down to trust. Whatever your concern about the vaccine, whether it's safety or risk factors or questions, to me, it's always about finding that person that people trust to impart that information. So we clearly see our role is to educate, but we also see our role is to work with our partners, whether it's Representative Collins tonight or when I was at Swope this weekend or the Mexican consulate. We're very purposeful about finding those people that we think people have a relationship with. And when they give them that information, they're a trusted partner. So I would say the gist of our campaign is to find those trusted partners and work with them.
Hey, Dr. Williams.
Hey, Jessica, how you doing?
I'm good. How are you?
I'm doing well. Hope you are.
Thanks. I am doing pretty well today. It's nice and beautiful outside.
It is.
So we've seen some progress with the vaccine effectiveness in children between the ages of 12 and 15.
Yes.
When do you expect kids in that age category to be able to get vaccinated, and do you have any concerns at all?
Yeah, great question. So I'm aware now that children, that there are efforts by pediatricians and others to start vaccinating the 16 to 18-year-olds in different locations using the Pfizer vaccine. It's the only one approved for that. And so there's talk about actually doing that. I just got off the phone with the pediatricians about starting that in 2 weeks, 3 weeks. And some of that may be going on now, which is fine once they become eligible, which will be April 9th if they don't have any comorbid conditions. I asked the pediatricians, and they think the EUA for the Pfizer vaccine may come as early as May or June. Which would mean that we would be able to go down to the age of 12. And then the whole question becomes, which I met with our team today and talked to Robert, what would that look like in an organized fashion throughout our 500 school districts for 12 to 15, 16-year-olds and 18-year-olds, for that matter, this summer as we prepare for August. But it's all very, very encouraging. It's an answered prayer to have this much vaccine a year later. I mean, we're doing 40,000 vaccinations a day. If you'd asked the governor and me a year ago, where this was all headed, to have 40,000 vaccinations every day in Missouri, and now to increase it to children, it's just a real blessing.
So, Dr. Williams, in areas such as Montauk County this week, there
Yeah.
were a lot of online call-outs on social media to
Yes.
encourage those doses to get taken. So right now in those rural areas, is the supply exceeding the population number of the people living in the area, or just the number of people who want the vaccine?
Yeah, it's a great question. Thanks for asking that. We talked at length with this with the minority members of the House last week from the Health Committee. This is an issue everybody across the country is dealing with, and I gave them some articles. I'm on the board of directors of ASTO, so I talk to my fellow state health directors all the time. And, this is an issue, and I sent them the articles to substantiate this from other states. As we try to obtain equity, which means that even if it's harder or even if it's a community that we know historically may not have the uptake, we just follow our North Star in trying to get it to the most vulnerable. So if you're 65 years old, we're going to try to get you the vaccine. Now, you may choose not to take it, but we're going to have it for you. Now, that creates issues because when they don't take it, then we have to redistribute it. And so people would say, well, then why do you do that? And again, as I explained to them, it's all about equity. But if you'll go to any state in the country right now, they're running into the same issue. That as we've been at this now for 3.5 months. When we send 500 vaccines to Montauk County or somewhere, as we do this more and more, we understand that they won't use all 500. That's just the trade-off for equity. Our commitment is they're not wasted, that as soon as we can, we redistribute them as quick as we can. Thank you.
Thank you, Dr. Williams. Governor Parson? Mike Sebastian?
Hey, Governor, I know you've been asked about this a couple times already in the past 12 hours, but are you aware of what the consequences would be if the legislature ships your budget without covering Medicaid expansion?
Yeah, I mean, I know what the consequences is, if that's what you're asking me, but I think you're a long way from that. I think that it goes through the Senate process, and we'll see what happens on that. I'm not sure what the end game will be on that or what will go across the finish line and whatnot, but we'll see when that day comes.
And so what would those consequences be if that happens?
Well, I don't know quite what you're saying, consequences. I mean, the process will have to work. Maybe I misunderstood your question. I don't know if there's any consequences of, you mean what the House done? Is that what you're asking?
I mean, if the state doesn't have enough money to cover the people who are eligible according to the Constitution, would that mean a lawsuit against the state?
We do have enough money. We do have enough money to cover the people. We put that in the budget. So that was in there.
Yeah, I guess, I mean, if at the end of the budget process, the budget that's passed by the legislature doesn't have the money that you recommended in your budget to cover the people who are now eligible.
Well, we'll deal with that when it comes. We'll have to see. I mean, if the Senate votes like the House did, then it's we got to figure out how we're going to deal with it and what we're going to do. But I think it's early to speculate that. I don't know what the Senate's going to do. Let's wait and see. And then they got to go to conference committee, I assume, on this. We'll just see what happens. But it's pretty early to speculate right now on what that end product's going to look like.
Along similar lines, do you think that not putting money for this, as you had requested, puts you and your administration in a tough spot?
No, look, there's whether you have different branches of government. I'm not always going to get everything that I want when I put it in there in my budget. That's kind of why I go first. Here's what I'm trying to do is lead, to say what we think is important, and then the legislators have to do their part, and they'll decide what they think is important, what's not. And I think that's the process you're seeing. Again, I think you're going to have to see what the Senate process turns out to be, what the conference committees are going to look like, and see what the end result's going to be. But no, I mean, it's the process.
I guess legally speaking, do you feel like you would be pulled between the Constitution's amendment that says these people become eligible July 1st versus having the money to do that? Like, do you feel like you'll be pulled between those two?
Well, I think I'm not sure what the end game of this will be or what exactly will happen, but I tell you, it'll be challenged. There's no question about that. If it's not funded, there'll be challenges to that. I think we all know that. So we'll just have to see how that plays out.
Hi, Governor. The Senate tabled Todd Graves' nomination this afternoon. So what is your message for senators who might be on the fence about Todd Graves, and are you confident that you can get his nomination across the finish line?
Yeah, it's up to the Senate. He's a guy we put out there to be on the curator. We put out there a process. We're going to let the process happen. I'm not sure what happened. I didn't get back till about 30 minutes before press time, so I'm not sure what they did. But if they tabled it, that's fine. I don't know. But, he's a guy we picked, and we're going to stay with him.
The Senate this week discussed and adopted an amendment that would prohibit transportation companies in Missouri from requiring vaccination passports. That's sort of been left up to the private sector as far as Washington is concerned, but what are your thoughts on that?
On the vaccine passport, is that kind of the question you're asking me? Maybe the question is, do I believe in a vaccine passport? No. We will never do that mandated to be able to do that. If the private sector wants to do that, I'm fine with that. If they want to do that, if a business owner or somebody wants to. But as far as the state goes, we won't mandate vaccine passports.
Hi, Governor. So we heard Dr. Williams talk about it a little bit with the situation in Montauk County and vaccines. At this point, are you considering readjusting your vaccination strategy at all in some of these more rural areas?
No, everything's going according to plan. And back in October, I was just in Phelps County today. The same thing, almost any center. You're going to see this happen in St. Louis. Trust me, when FEMA gets in there and they try to do 3,000 a day for that many days, you'll see days they'll be trying to find some place to go with the vaccine. That happens all over the state. Phelps County today, because that was one of the things I asked him, I said, kind of how's this work? And of a morning, there's normally a rush. In the afternoon, things start slacking up a little bit, and then you have those employees of afternoon. But I think most of them are having that same problem. But most of these health departments, and give credit to them, they've got backup lists, they've got people they can call, and to be able to administer those vaccines. A lot of the things that were being said early on, like 1,000 doses was going to waste here, 1,000 was going, never ever occurred. That never occurred. We did about 2.4 million, and I think the waste side of it has been 400 of the vaccines that were wasted in the state. But no, our strategy stays the same. I mean, everybody deserves to have a fair shot of vaccine. And I think, I'm not sure in California, Dr. Williams probably know, but in Montauk County, was you talking 500 doses? Is that what you guys were talking? You know, we just did 20,000 in St. Louis.
They had, like,
I mean,
felt like
so it's like, I'm just telling you, we don't want to waste anything. But when you go to some of the rural areas or whether you go to cities, you're going to have sometimes you're going to run out of people doing it. You're going to have to find somebody to do that. I think Cole County's run into that problem, about every county. Hospitals have run into that problem because they're extinguishing their list, which is a good thing. That's what we want, is to be able to. I've said this all along. I think by the end of April in a lot of places, you literally are going to be either be looking for people to vaccinate, or you're going to be putting them in the local levels where you don't see these mass vaccine or these vaccine clinics. You're going to be able to go to the doctor, you're going to be able to go to a pharmacy, you're going to be able to go to a healthcare clinic and get a shot in most places. And the sooner we get to there, better.
Governor, question about mega vaccination sites and also FEMA that's coming in. We know that it's coming to the St. Louis area. Is there conversation about it happening in Kansas City? That's the first part of my question, if there's other parts of the state. Now that you have completed mega vaccination sites in Kansas City and St. Louis, with one coming up in Springfield, any plan for that to happen again? I know they were very successful, but I didn't know if there was a plan to have those happen again. Two-part question there.
Most certainly. We will be back in Kansas City. I would assume we'll be right back at Arrowhead. We know that was a huge success. We'll be back there just as kind of a time schedule would go, but I would say we'll definitely be back there in April to be able to do again. I think what you're seeing now with FEMA and what we're actually seeing in mass vaccinations, we kind of branded, I want to say, smaller things as mass when we were doing thousands or we were doing 2,000s. The whole intent with the National Guard and for all of us is to do what you were seeing in Arrowhead, to see what was doing in St. Louis and Springfield, to do those 10,000 type events with all the manpower we could have and get all the logistics involved. So now with vaccine coming more and more available, I think you will see that probably much more likely in the urban areas than it will be in the rural areas for that, just because the demand will be different. So, but yeah, we'll be back. And look, if FEMA brings more doses in here and brings more vaccine, they can go wherever they want. I'll sure do whatever I can to help them. If they want to go to Kansas City, if they want to go to Springfield, wherever they want to go. If they want to come to Bolivar, Missouri, I'll bring them home to Bolivar. But we want them to come here. But the whole problem has been, and I want to stress that again, is simply the vaccine, having the doses available to do all this. But right now, you're just starting to see this thing really kind of get to a new level. And if they bring that in St. Louis, it'll be a good day.
So there's no plans, just St. Louis at the moment. You don't have any plans in the work for Kansas City, for FEMA?
FEMA does not that I'm aware of through FEMA. That is correct. We've talked about different things, but that scenario is not on the table that I know of right now.
Governor, House Bill 75 was discussed yesterday in the Senate committee to limit the local health department authority and require local elected officials to kind of approve their orders. What's your take on that issue?
Yeah, you know what? This conversation's been going on all year. I don't know what that final product's going to be. You know, I think some level heads will prevail on this and figure out how we do things better in the future. I think, I don't think there's any doubt that there's a lot of people think they overstep their boundaries. You know, if some of the local health departments that did that, some of your people. So it has to be addressed. All that has to be go on the table and see is there a way to do it better. And other states are looking at the same thing, coming up with legislation. But again, just because something come out of a committee, as most of you know, it's well too early for me to ever make a judgment call on anything like that, because I don't know what the amendments look like. I don't know what the end product is. So I'm always hesitant to say, what I think about it, other than I think that conversation is going to continue.
My last question, Kurt.
President Biden unveiled an infrastructure improvement plan that's really, really big. So Missouri would, you'd expect, be in line for some serious money. Does that negate the need to raise the gas tax by, 2 cents a year? And if it comes, what's your priority for the spending? More for roads, bridges, broadband?
Well, if it actually is a infrastructure plan, again, it depends what all is in there to say that. I think there's a lot of, I'll give you on the political side of it, I think it's packed with the new Green Deal that's in there also. So I don't think it's just about roads and bridges. I wish it was. I would say that because that's something we really want to do. If we get the opportunity to use federal money to build bridges and build highways and airports and rail in here, we're always encouraged about that. That's been a priority of mine from day one. But that thing's a long way from getting through the finish. But the one thing I would say, why I believe at some point Missouri we have to stand on our own feet. and we can't be relying on the federal government all the time for everything. And as much as we can do on infrastructure here in Missouri, we need to be able to take that responsibility on our own shoulders. Feds are there to help, but I don't want to be totally relying on them for everything we do. All right, thanks. Kelly, if I could see Kurt and Jack after this, if they come by, I'd like to talk to you guys for just a minute, please.
All right, thank you.